Sitting up, well, hi everybody, this is me, this is Jamal, I'm sitting up right now, and I'm actually watching yesterday's episode of PBS's Newshour, and they're actually talking about the exchanges. They're talking about the first day of the healthcare, open October 1st and stuff like that, and the glitches and stuff like that. And I just wanted to say this. They had a segment in which they brought up the Massachusetts model, the Mitt Romney model, as that being a model for the exchanges that are going to be around the country in the various states. They did a story. I think it was pretty fair. They had the pros and the cons of the Massachusetts plan. The pros being, they say that 98% of the people in Massachusetts are covered with health care. A lot of the people who have health care, they're satisfied with their health care and all that stuff like that, and that's fine. If you want health care, and if you want to live in Massachusetts and the state of Massachusetts wants to have health care and they want to raise revenue amongst their own people, meaning tax the people who live in Massachusetts, basically to redistribute the wealth from the haves to the have-nots to provide health care for people who quote unquote can't provide it for themselves, then fine. If that's what the people in the state of Massachusetts wants to do, then that's fine. My problem with health, and I am a person that believes in people having access to affordable health care. Now, of course, I don't believe that the government is the best option to that, because even the story that they had on PBS Newshour in the con segment of the Massachusetts healthcare plan story, they talked about the cost. They talked about the exorbitant cost and how year after year since 2007, when Mitt Romney signed the law into effect, how the cost for healthcare in Massachusetts has continued to skyrocket, even though that was a promise. That was one of the selling points for actually passing the law in the first place, that the cost of healthcare before the law was so exorbitant and that we needed the government to step in and basically drive down the cost. Well, the opposite has happened, that every year the cost is going up. Every year for Obamacare, the cost is going to go up. So that's my real issue with the government healthcare. I mean, yeah, you say that you have good intentions, and I understand all that, and then but like the saying goes, there are negative consequences to sometimes the good intentions, and and that is the story of government healthcare. Even from PBS's own story, you can tell that they tried their best to spin it in a positive light, to show Massachusetts healthcare system in the most positive light they could, But when they were interviewing the experts, the experts were saying, we have 98% of the people that are so-called insured, but the cost, it's the cost, the weight. They were just talking about now how all these people are just showing up in these emergency rooms, and they don't have enough doctors, they don't have enough nurses. There's a shortage. It's already, you have a rationing of care, and the law in Massachusetts has only been in place since 2007. They are already rationing care. This is what one of the doctors said, and when they were interviewing him on the Newshour. And I think, and that's a trend that I worry, and that a lot of people worry will actually go nationwide. That there will be, they have already been stories. You can Google it. Google nurse shortages and doctor shortages. There have been doctor and nurse shortages for years. In the United States, and Obamacare is now making it more likely, that people are not going to go into, primary care. That you have a lot of people who are opting to go into what they call these concierge medical services, in which basically you have a concierge. I didn't say that right. Sorry. It's basically when you have a private doctor. Essentially, that's at your beck and call. You pay them, you're not using insurance. Basically, the middleman is out of it. It's just you and the doctor, and you pay them like it used to be. I don't have a problem with that, actually. But, anyway, let me just say this to President Obama. He said that in his news conference that the reason that there were glitches, quote unquote, on the first day of Obamacare was because it was like over 1 million people or something like that went to the website to try to sign up for healthcare. Well, Mr. President, let me say this. I was one of those people who went to the website at 7 a.m., a little before 7 a.m., to the healthcare, healthcare.gov. I wasn't going to sign up for Obamacare. me and probably tens of thousands, maybe hundreds of thousands of those 1 million people were just going just to see the sticker shock. I just wanted to see how much it is going to cost under your plans to get under your your healthcare regime, to get healthcare. I was just curious. It had nothing to do with anticipation, and that was the tone that he was trying to set. That was the picture he was trying to paint to the press during his little, Rose Garden press conference. That it was, people were rushing to the website because they were so eager to sign up for Obamacare. No. People were going. There were ordinary people just like me, who were interested in, in the policy and really, like I said, I just wanted to see the sticker shock. I really wanted to see how much this thing costs. And then you have other people, you have reporters, all kind of people who were going to the website for various reasons. I'm sure you probably had some that were going to sign up. Fine, but I can assure you, Mr. President, it was a minority. Anyway, it's Jamal. It's 6 minutes in this video, and I'm about to sign off because I need to eat breakfast.